Hello, I'm Dr. Hilary Jones, a GP and medical broadcaster. Some of you may have seen me on Breakfast TV over the years talking about a wide range of medical issues. Now, I've teamed up with Pall Mall Medical and I want to answer some frequently asked questions about moles and mole removal, why they're important. We want to talk about how to monitor your moles and what happens when you have one of those removed. So thanks for watching. Let's start with moles and are they dangerous? Well, by and large, moles are benign. Most people have on average about 200 moles if they counted them all up, scattered over their bodies. And the thing is, they can change over time, particularly if we're exposed to a lot of ultraviolet radiation or even without that. So changes can indicate an increased risk of skin cancer called melanoma. And malignant melanomas are one of the fastest growing skin cancers of all, which is why it's so important to have those moles checked on a regular basis. When should you get your mole checked by a healthcare professional? Well, if a mole has changed, it could be suspicious. So if it's changed in size, if it's changed in color, if it's greater than 7 millimeters across, that is bigger than the blunt end of a pencil, if it has an irregular shape, and if the color is different in different parts of the mole, or if you see satellite lesions around the existing mole, if it's inflamed, if it's bleeding or oozing, all of these are signs that the mole could be becoming cancerous, and it certainly needs to be checked. When would you need to have moles removed and how would it be done? Well, the treatment for suspicious moles is very simple and the treatment is an effective way of removing either moles that are just unsightly or, as I say, that are suspicious and potentially dangerous. So removing them is a key step to staying healthy. They need to be removed to make sure that the mole hasn't become malignant and cancerous. So they can be removed in two main ways. They can be removed by something called a shave excision or a surgical excision. With a surgical excision, the consultant dermatologist will cut out the mole with some healthy skin around it. And the incision is deep enough to take all the cells away that are underneath the mole that you can see. And in this situation, stitches are almost always required. Shave excision is exactly that. It is used on smaller moles with a small blade which shaves off the top tissue and some of the tissue beneath, and stitches aren't usually required. Now at Pall Mall, histopathology is always included as standard. It means two things. First of all, it looks at the sample under the microscope to make sure that the lesion was cancerous, and also that the surgeon has got all the borders of the cancer so we know it's not going to return. How much would it cost to have a professional mole assessment? Well, the assessment itself, carried out by a consultant dermatologist at Pall Mall, is £150. The treatment would be extra, but no referral is needed. You can simply call and book your appointment. People also often ask, does the mole removal hurt? Will I have a scar, and how long does it take to heal? Well, having had a mole removed myself, I can tell you that it doesn't hurt because you have a local anaesthetic and you won't feel hardly anything. Secondly, you may have a small scar depending on the size of the mole that needs to be removed and the location of the mole. And you can also rest assured that it'll all be healed within a couple of weeks. Might be slightly itchy as it heals, but that's not a bad sign. What I would like to finish with is the importance of using sunscreen to protect yourself from the harmful rays of the sun. We're in summer now, and people often underestimate how powerful the sun's rays can be. So it's good to cover up with sunscreen. Use adequate amounts. Use a strong enough sunscreen with both UVA and UVB protection. And if you've got a very vulnerable skin, if you're pale skinned, blue-eyed particularly, with lots of moles, you need to take extra precautions. What we do know is that the more times you're sunburnt in your life, the greater the risk of developing skin cancer in the future. So be careful, be sensible, and cover up with the sunscreen.